Hello, I'm Dr. Nicole Alexander-Scott. How is everyone? I'm sorry that I couldn't be there, but I'm thrilled that I have the opportunity to still share a few words about an important epidemic and about a dear colleague that I'm very proud of. In keeping in line with the keynote speech from Dr. Bonci, I was asked to briefly speak to the state of the opioid addiction epidemic in Rhode Island, as it's indeed one of the most important public health crises that we have faced. Along with the director, Maria Montanaro, of the Department of Behavioral Healthcare, Developmental Disabilities, and Hospitals in Rhode Island, both of us co-chair Governor Raimondo's Overdose Prevention and Intervention Task Force. The task force will be presenting a strategic plan to the governor on November 4th, as it is committed to putting an end to the addiction and overdose epidemic in our state, and it's possible in Rhode Island. Over the last 5 years, we have lost more than 1,000 lives to drug overdoses. Those were 1,000 preventable deaths. And last year, just 239 lives were lost alone. Again, an epidemic that we need to stop, and now is our time. The problem, as all of us know, is multifaceted. There are prevention changes, treatment changes, recovery, and reversal things that we can do to address the epidemic. We look to our prescribers and providers to really help us address it from the prevention standpoint. There are options like making sure that every prescriber is enrolled in our prescription drug monitoring program. We also want to increase prescribers who offer Suboxone or buprenorphine as an option for treatment. And there's much more that we can do together to raise awareness and improve stigma that truly exists for our patients that we care for. As healthcare providers and prescribers, we can continue to educate ourselves about the tools available to help us fight this public health emergency. We know as a department and are committed to improving the capacity that prescribers need to really be able to get the work done. There are alternative treatment options and recovery options that need to be available for patients. We absolutely have our work cut out for us. But with the collaboration of law enforcement, public health officials, healthcare providers, behavioral health service providers, legislators, advocates, and community members, we can and we will turn this epidemic around. My next job today is to introduce your next speaker, who is the past recipient of the Bruce M. Celia Award for Research Excellence, Dr. Rami Kantor. Dr. Cantor, as many of you know, is an associate professor of medicine in the Division of Infectious Diseases, Department of Medicine. He was recruited to Lifespan Brown University when I had the honor of meeting him in 2005, where he completed a clinical infectious diseases fellowship and subsequently joined the University Medicine faculty. He currently is the director of the HIV Resistance Laboratory at the Lifespan Brown Tufts Center for AIDS Research. And he's also the director of research for the Brown University Kenya program, as well as a member of the Center for AIDS Research Retrovirology and Biostatistics Core, and a member of the AIDS International Training and Research Fogarty Executive Committee. Dr. Cantor has conducted research in India, Thailand, China, Kenya, Ghana, Ethiopia, Cape Verde, and Israel. Tremendous. He has been part of networks such as the AIDS Clinical Trials Group and the World Health Organization HIV Drug Resistance Network. Dr. Cantor has been committed not only to research, worldwide, but also to education. He's been a phenomenal mentor to me and countless others. Major themes of his research include HIV diversity, treatment monitoring, and the evolution of drug resistance, which is so crucial for us to understand. He is currently working on HIV drug resistance, transmission, and diversity in adults and children in Rhode Island and in resource-limited settings throughout the world. In addition, he is working to develop advanced methods to detect and interpret HIV drug resistance. On top of that, additional current projects involve establishing point-of-care platforms for HIV drug resistance testing in resource-limited settings and monitoring HIV-infected patients with limited resources so that they can still live healthy lives. Rami, you have been a phenomenal colleague, someone who I have truly admired over the years, and a mentor to me, as I have mentioned. So I am so very honored to introduce you and to celebrate your wonderful, inspiring work. Your commitment to HIV patients, to research, to education, not only here in Rhode Island, but worldwide, is commendable and is something that I certainly want to follow in your footsteps with. Congratulations on your many achievements now and going forward. And together, I'm looking forward to helping advance the efforts of those of us working in public health and in infectious disease prevention. Thank you, Rami, and congratulations.